Good afternoon, and thanks again to the members of the press that are on the line. Today I'm going to focus on efforts to prepare countries, and especially their health systems, for responding to a global epidemic. But first, I should point out, as expected, we're seeing new confirmed cases of influenza A H1N1 in countries of the South that have been previously uninfected. Argentina today reported 1 case, and Brazil is confirming 4 cases. In Brazil, 3 of those 4 cases had a travel history to Mexico, and 1 had a travel history to Florida. Similarly, Argentina, the case also had a travel history to Mexico. In both countries, we should expect to see more cases, as we should expect to see more cases in other countries of the Southern Hemisphere not currently reporting cases. We know in both countries of Argentina and Brazil, there are more suspect cases being investigated. For the past 4 years, PAHO and WHO have been working with their member countries to be better prepared for a possible pandemic. A key target with this work was to ensure that all countries had an adequate preparedness plan, what we call an emergency preparedness plan. These plans cover necessary actions to prepare themselves, especially their health systems, for each of the pandemic alert phases, and we are currently in alert phase 5. Here in the Americas, because we are actually in the eye of the storm, most, if not all, our countries have implemented their emergency plans in advance of the Phase 6 announcement that may or may not take place by WHO. Required actions to the pandemic response, including stepping up surveillance and laboratory testing of patients, preparing to handle a substantial increase in the number of illnesses, and being able to impose public health measures that might be necessary, including closing of schools and restricting public gatherings. As a part of this work, PAHO and WHO have developed detailed checklists so that countries can use these to assess their current response, assess their health systems, and identify potential areas of weakness and gaps for an adequate pandemic response. When these checklists were tested in mock-up exercises in the countries of Latin America and the Caribbean, one of the areas that appeared to need more work was the protection of health workers and health facility infection control procedures. We know from previous experiences with seasonal influenza, health workers can be agents of transmission if they're infected, particularly in lieu of the fact that a day before the onset of symptoms, people transmit the virus. Now, it's important that countries reassess some of this work and go back to those weak areas and make sure that any gaps have been filled. For example, do health workers have the adequate personal protection when caring for patients? Have they been trained to use this personal protection? It's very important in a pandemic to protect those health workers because they are on the front lines protecting the health and people and their families. Strengthening infectious control procedures to prevent influenza transmission in healthcare settings to patients seeking care is essential. One basic but most important measure is more aggressive hand hygiene. We have repeated this message over and over again as one of the most important things that you individuals and your families can do at the community level to prevent transmission. But this also applies to healthcare workers to prevent transmission from themselves to patients they care for. And recently, WHO released its new guidelines for more aggressive hand hygiene measures among health workers of the region. It's very difficult, if not possible, given what we know about RNA viruses, to predict the number of people in the world that will become infected. But it certainly raises a question. how prepared are countries' health systems to deal with a major increase in the numbers of people falling ill. Part of the pandemic preparedness process has been to assess each country's health system and map out how it will handle a substantial, huge surge in new influenza cases. Health systems need to be able to utilize their full capacity and be able to use good triage mechanisms to ensure that the sick are adequately cared for. Another area of pandemic planning that PAHO and its member countries has been working on is social and risk communication to ensure transparency and build trust within the public so that the public will accept important public health measures such as closing of the schools, restricting social gatherings that should have an impact on disease transmission. We have seen this in Mexico thanks to prior implementation and preparation in this area, and they were able to achieve the public trust and accept high levels of cooperation when public gatherings were restricted and so forth. So, implementation of pandemic emergency plans requires effective coordination at every level, ultimately leading to the use of the most effective preventive measures in the individual, family, and community levels of the health system. Please refer to our PAHO and WHO websites for materials on pandemic preparedness. And let me stop there and entertain any questions that you may have.
Thank you. Thank you, Dr. Andrus. We have questions by mail and by phone still working their way through, so I will go through the ones that we've gotten on the chat line on Illuminate. From Brazil, we have a question from Folha, who the reporter Gabriela Mancini asks why WHO is already talking about asking labs to start to produce vaccines for this new influenza strain when specialists said a few days ago that the vaccine would take 4 to 6 months to be ready.
It's a very good question, and I think I'll turn the question around to pose the recommendation that since a vaccine will not be ready in 4 to 6 months, that we do everything we can to be sure that the mitigating measures are being implemented that I've reviewed that include hand washing and personal hygiene and social distancing. That will be highly important to slowing down transmission. We are lucky, I think we're very fortunate that as we speak today, we can be talking about 4 to 6 months. If it was 2 years ago, we'd be talking about 6 to 8 months before an effective vaccine could become available to protect particularly our highest risk individuals in the community and prevent unnecessary deaths.
Thank you, Dr. Andrus. And then we have a question from the newspaper in Argentina, where the reporter asks, since we have already a case reported in the interior of the country, is it possible that this virus will spread through the rest of the provinces with the speed or the strength with which it has spread in other countries that were already affected by A-type virus? And the second part of it is, does the risk of contagion vary for people according to whether they're in a rural area or an urban area? How do socioeconomic conditions influence risk of contagion?
Those are excellent questions. And with the first question, the reporter mentioned that the current confirmed case is in the interior of Argentina, suggesting that that person might be in a rural setting. And of course, what we know about the dynamics of transmission, that it won't be as intense as if that person was in Buenos Aires, for example. So the The question in regards to risk of transmission is also very good, and I think it is related to population density. I think a guiding principle of transmission of all infectious diseases is that when you have more crowded, densely crowded conditions, likelihood of transmission is going to be higher. We see that with polio, measles, almost any infectious tuberculosis, any infectious disease you can name, and certainly applies to this virus. We are learning that there are other factors. There are host factors, for example. A person who is malnourished may be more likely to become infected, may be more likely to have severe infection. We know that children with vitamin A deficiency have an overall increase in mortality of up to 23-24%. So those are factors related to the individual, or what we call in epidemiology the host. There are also factors in terms of the environment. We, in public health epidemiologic circles, think of disease in terms of the host, the agent, and the environment. And that's why this question is so good, because you're covering these issues that are very important in understanding the transmission. In regards to the environment, what we're finding, or what has been hypothesized, is the crowding in winter months, huddling up and staying warm in more confined areas like your home would also contribute to more effective transmission. People are hypothesizing that the relative decrease in humidity provides an environment that the virus prefers, and then leads to transmission, where on the reverse side, in the summer months where it's more humid, the virus is less likely to transmit. So we don't see nearly the numbers of cases in the summer months. So those are all contributing factors, and very good question.
We now have a question from El Universal in Mexico. Doris Gomorra is asking, if she says, I am just wondering if after this outbreak, PAHO is considering to change the procedures for an epidemiological response. If governments must change their procedures and make them more efficient and to respond quickly for an epidemiological situation, what is it that the governments need to respond quickly? Do they need more laboratories, more communication equipment, or what? If winter is going to begin next month in the southern hemisphere, are governments ready to respond to the next outbreak?
Another very good question, and we've talked about, as I mentioned in the presentation, the work that's gone into preparedness over the last 4 years, and without that work, I don't think we'd even be close to the kind of the response that's been solicited with this current crisis. So I think with each crisis, we learned something. I recall back in 1991, I believe, in the Americas, we had the largest cholera outbreak last century, and some historians refer to it as the 7th global pandemic of cholera. And so we learned a lot about how to respond to that outbreak and stop transmission of cholera in the region. And as we go along, again, we learn more and more. Last year we had the first urban yellow fever outbreak in the region in more than 40 years. This was in the peri-urban area of Asunción. And countries stepped up to the plate and donated vaccines so that Paraguay could vaccinate its population and control and end transmission in Paraguay. So I think more and more the system gets more mature and able to respond to the emergencies. But does that mean that we're doing A+ work? No, I don't think so. I think there's always room for improvement. And the author of that question highlights important issues that we should be thinking about. For example, we know we're trying to do operational studies in the field that would address exactly those questions the author or the reporter mentioned, so we can learn more and apply those lessons learned to the next time we have a crisis.
Okay, thanks, Dr. Andrus. We have another question from Nelly Castillo in El Salvador, who asks about health workers. What are the recommendations for protective equipment for health workers in the role of first responders at this stage of the situation?
The guidelines that I mentioned posted on our web and WHO's web go into great detail and I think are very helpful for local health officers and health providers to use as guidance in your preparation. So I'll leave that as a general response. They go into great detail that I think will be very, very helpful for your work at the point of service in El Salvador.
Okay, thanks, Dr. Andrus. And then we have Fabricia Peixoto from BBC Brazil, who's asking, until what point does the genetic of the contaminants explain the transmission? Or I think she means the genetics of those who are infected by the virus. Are there genetic factors in becoming infected and succumbing to influenza?
There are genetic factors, and those factors are related to what I mentioned about the host factors, the factors related to the patient's innate health status. So to the fact that I might be hypertensive, diabetic, then I would be at risk for more severe disease, and I can imagine certain conditions that would even make me more likely to transmit diseases if, for example, I have a diminished immune response as you do with chronic disease.
Okay. Are there any phone questions? Do we have phone lines working? Okay, they're working, so no questions. And I think you've done such a good job that we've answered all the questions.
Excellent.
Okay, so thank you very much, Dr. Andrus.
Yeah, thank you, Dan, and thanks to everybody taking the time to listen to this briefing. Thank you.